Hi, everyone, and welcome. Thank you so much for joining us. This is our April monthly Children's Mental Health webinar. We appreciate everyone coming here, and for those of you who are getting the recording later and watching it at another time, we appreciate you registering so you can get all of this valuable information. This webinar is supporting your emotionally dysregulated ASD child, and it will support caregivers in identifying frequent triggers that lead to emotional dysregulation, provide trauma-informed de-escalation strategies, as well as discuss supports to prevent or decrease the frequency and intensity of dysregulation in autistic youth. I am super excited for this webinar. I have an autistic son, so I'm looking for some fantastic ideas on how to help him stay regulated. And presenting today is Dr. Antonia Girard. She's an assistant professor and licensed psychologist with the Division of Child and Adolescent Psychiatry at the University of Maryland School of Medicine, and she is the assessment clinical director and specializes in autism spectrum disorder evaluation for youth. We are so excited to have you here today, Dr. Girard. Thank you.
Thank you. And thanks for having me today. I unfortunately cannot see anyone on the screen, or so if there is anyone that has a question or anything, please feel free to just interrupt me as I go through the information. I will go ahead and get started here. There we go. So we've already gone over the objectives for this webinar, so I'll go ahead and just jump right into things. So some notes that I would really like to highlight in terms of autism and some of those challenging behaviors that are often associated with autism, that having a diagnosis of autism itself doesn't cause challenging behaviors. It's not part of the diagnostic criteria for autism to engage in challenging behaviors. So sometimes that can be a bit of a misconception that that's always the case. However, we do see a lot of autistic youth that struggle to regulate their emotions and behaviors, and oftentimes that's because they're trying to communicate to us that something doesn't feel right or that there's a need that hasn't been met, and they may not be able to do so in a way that effectively communicates those needs to us. Another piece that can contribute to those challenging behaviors are how others have responded to those behaviors in the past. So if engaging in aggressive behaviors have led to a child getting the need met, it then is paired with using those behaviors in the future of, oh, this is then how I'm able to access what I need. So sometimes it's also more of a learned behavior that those around those youth are maybe inadvertently reinforcing. So some kind of statistics regarding aggression specifically in autistic youth. We know that younger children tend to be more aggressive, more likely to engage in self-injurious behaviors, ritualistic behaviors. So if there are autistic youth that is part of their diagnostic presentation of autism, they can engage in more of those severe behaviors. Also, we know that autistic youth oftentimes are very resistant to change. Unexpected changes, transitions can be really challenging when they feel like they've lost control and aren't able to know or navigate what's happening next. And then also those social impairments. So if they struggle to pick up on social cues, being able to read on others that, they don't appreciate the behaviors or don't like them, that can also contribute to some of those aggressive behaviors. And when it comes to that younger age piece, the reason this is the case that aggression is heightened in younger autistic youth is oftentimes with age comes more ability to control emotions because of increased communication skills, learning more adaptive coping strategies that then in turn will reduce some of those challenging behaviors. So some of the triggers that we often see in autistic youth that tend to lead to escalation in the first place are sensory overload, difficulty understanding a situation, either understanding what's coming next or why something is happening the way that it is, having poor coping strategies, not having learned other ways of being able to manage when they feel dysregulated, and what we call autistic burnout. And I'll get to what that is more specifically here in a second. But first, we'll take a look at an example of what sensory overload can look like for a child. So I want to give a little bit of a trigger warning. There are a lot of sensory components to this video. So if it does bother you, feel free to, turn off the sound on your computer or, look away from the screen and if it is triggering for you. There are going to be a lot of sounds and lights and things like that. But want to give you a sense of how a lot of autistic youth experience the environment around them.
Six, 7, 8, 9.
Take my hand.
I'm not naughty. I'm autistic. And I just get too much information.
So that's a really nice example of how things that we experience in our everyday lives in terms of sensory input from all of our senses can come together and feel really overwhelming, especially for individuals that are more sensitive to sounds, smells, tastes, textures, and it could very quickly get to a point where they feel like they are not in control of their responses to those environments anymore. Autistic burnout also not only can be attributable to some of those sensory overstimulation, feeling overloaded, but also when children are suppressing their autistic traits, if they're trying to um, maybe minimize stimming behaviors or trying to control some of those sensory components in situations. And they spend a lot of time trying to suppress those autistic traits that can understandably be very overwhelming and feel like it's taking a toll on them and then not allowing them the resources to be able to control their responses in those situations. Stress, of course, impacts all of us and can lead to frustration, anger, and in some cases, aggression. Those changes again, so changes in routine, changing environments, something new, unexpected happening, not getting enough sleep. I think most of us can relate to that. Certainly can increase irritability and frustration. And then being sick, illness is also a contributing factor, and sometimes too, depending on the age and communication abilities of autistic youth, they may not be able to tell us verbally that something hurts or they don't feel well or they have a stomach ache, which then may result in some challenging behaviors when they can't communicate those pieces, but they don't feel good. So prior to attempting any de-escalation with any youth, but specifically autistic youth, it's very important to check in with ourselves. If we are not in a place where we are regulated, it would be a very large ask to then be able to appropriately be able to regulate someone else. So we really need to be mindful of checking in with ourselves. It's important to remember that this individual that is escalating in front of you is doing the best that they can in this situation. They are using their past experiences and they're using the skills that they do have. And in some cases, it may not be enough. And so we need to be mindful that this child is not trying to be bad, is not, wanting to engage in these behaviors that are harming others. But their coping skills have been maxed out, and they are no longer able to manage their behaviors and emotions. Also, we need to be considering why someone would be behaving the way that they are in order to be able to help appropriately. So, if we're getting a sense that an environment is overstimulating or that something isn't going the way that they had expected, or there's a significant change, we want to be understanding of those pieces and have that context as much as is possible. It's not always possible in situations if we're just stepping into them, but trying to get as many context clues. And then also being very mindful of our own body language and facial expressions. If we are approaching others in a more confrontational way, maybe hands on hips or things like that, that can be construed by autistic youth as being potentially threatening. And so we do need to be mindful of the look that we have on our faces, our body language. And also we may need to engage in some modulation strategies for ourselves, engage in some self-talk. I can handle this situation. I am able to, remain calm. I can do it. I've done it before. Or engage in some relaxation strategies, taking deep breaths, counting to 10. There are a variety of different ways to try to regulate ourselves before attempting to de-escalate someone else. So de-escalation itself refers to any kind of techniques that are used in order to decrease agitation, or if it's gotten to that point, aggression in another individual. There are verbal techniques, there are nonverbal techniques. You can combine both of those techniques, and I'll get into some of those specific strategies here momentarily. But I also want to highlight this escalation cycle. And it shows that, there are typically some things that occur prior to an individual getting to that peak escalation point. And so we also want to be mindful, and I'll get into some of this, of those triggers. Some we already talked about. So sensory overload, autistic burnout, unexpected changes. So the things that we know that are going to be hard for individuals, and then also if we're seeing them start to become agitated, and then we want to get a child that is then, getting to that peak point to de-escalate. So here is a list, if you will, of different de-escalation strategies that can be really helpful, and I'll go into them more specifically. But there are quite a few different strategies that we can choose to take. So there is certainly overlap between different strategies, and it's okay to try a strategy, and if it doesn't work, try something else. Every individual is different. Every autistic individual is different and will respond differently, just based on their experience and the way in which they feel calmed. And so we need to be mindful of that. So wanting to provide a number of different strategies and examples of things that we can use. So starting with distraction, and I have this one listed first for a reason. So distraction is a technique that is most effective if it's used early on. So going back to that escalation cycle, using it when in that trigger or as agitation is starting part of that curve. If we're able to distract youth in that moment before that agitation becomes elevated, we may prevent a full escalation, a full meltdown, a full tantrum prior to it getting to that point. And some distraction strategies include, a preferred item or activity, if someone likes to color or draw, or if there's a video that you can play on your phone, or if you're by a TV or something, to be able to distract. Now, some questions that sometimes come up of, well, is that reinforcing a child? If they're starting to get agitated and we're saying, hey, here's your favorite thing, aren't we reinforcing the behavior? Well, that's why we want to do it early on. If we know that, oh, this child is ready to go outside for recess, they've been looking forward to it all day, and it just started pouring down rain and now they can't go outside. Well, before they even are realizing that this is not going to be a possibility, engage in distraction. Oh, we have this really fun game that we're going to play that I know that you love, and try to get them away from focusing on the fact that that beloved recess time is not happening, and engage them in something else may hinder that escalation from even happening. Another important component is attunement, and this is talked about in a lot of trauma-informed interventions, and I don't know how familiar you all are with some of those different interventions, but things like the ARC model, where they really highlight attunement and being able to understand and match another individual's emotional state. And there are some different ways that we can become attuned with someone who is escalated. One big strategy is what we call active listening. So if a child is upset, we want to accept their feelings, be respectful of them. We want to indicate that we're listening. Some of those visual cues that we can use are giving eye contact, nodding along, making sure not to interrupt them while they're speaking, even if you don't agree with all of their points of why they're upset. And then once they're finished speaking, summarize what they said, in order to make sure that you've heard them correctly. And that way they can also clarify anything that maybe was misinterpreted. We want to be very careful not to say like, oh, you're getting upset over nothing, or this is not a big deal. We really want to value what their experience is of the situation. And also not rushing to action right away is really important. A lot of us tend to be fixers. We want to step in and fix the problem. Someone is upset. We want to make them not upset. How do we problem solve? How do we fix what's going on here? Sometimes that is not the best approach to take. And that active listening piece is just as, if not more important than actually solving the problem. Sometimes just listening is what an individual needs to feel validated and help them calm down. So this kind of goes back to that check-in prior to attempting de-escalation. We want to make sure that we're remaining calm. We have to appear non-threatening. That body language is so important. So we don't want to stand with our arms crossed or hands on hips. We want to be mindful of our facial expressions. We don't want to be furrowing our brows, rolling our eyes, anything like that would indicate that we are being invalidating, or that we're angry, or that we're upset. We want to remain calm and neutral. We also want to be aware, of course, of our voice volume and the tone of voice that we're using. So even if the child is yelling and screaming, we're not going to match that tone. We're going to use a calmer, more appropriate voice volume. I also have this picture of this woman sitting down because it's also important to get on the child's level. So if you are both standing and you are much taller than this individual, you want to either both of you sit down, or you sit down, or even kneel down to get to their level. We don't want to have kind of that power differential of standing over someone else. And sometimes that might even be sitting on the floor with a child. And so that kind of gets into this piece of getting on their level, and making sure that they feel like we're on an even playing field, as you're going through that de-escalation process. And that in and of itself is de-escalating as well. There's also something called emotion coaching. And some of these pieces I just touched on, but it goes into it a little bit more thoroughly of, and overlaps with that attunement. So we want to attend to the emotion. So when a youth is upset, we're acknowledging that something's wrong. And an example of what you can say is, I can tell that something's going on right now. I can tell that, you're upset. We want to name the emotion. You seem really mad. You seem really sad. They can certainly correct you if that's not accurate of how they're feeling, but we do want to try to put their emotions into words, because that can help them learn to identify, if they haven't already been able to do so, the vocabulary to go with their emotions, so that the goal being down the road, when they are feeling really mad, they can say, I'm feeling really mad, instead of showing us how mad they are by excuse me, becoming aggressive or yelling and screaming. And then we also want to validate the emotion. So talked about that again with attunement, but very, very important. All emotions are valid. Even though we're not saying that the behavior is valid, if they are becoming aggressive towards others, you're not having to say that that is a valid and appropriate way to show their feelings, but the feeling itself is valid. And you can say something like, it makes sense that you're mad because, we didn't get to go out to recess today, and I know you've been looking forward to that all day. And then getting to that point of meeting the need of the emotion. So that's helping the child get through the emotion until it passes. And here's just some examples of how to do that. So if a child is sad, being able to provide comfort. If they're afraid, make sure that we're providing a safe and secure environment, that can be like a calming corner in a classroom. It can be going into their room where they feel most comfortable and secure. It could be removing from an overstimulating environment if they're out in public and taking a break. And then with anger, being able to match them, excuse me, with patience, and still setting appropriate boundaries of what will and won't be tolerated in terms of things like aggression. So then we also have this a sequence of engagement, and it kind of overlaps with what we were just looking at of the steps of getting through that escalation. So we start by regulating. We regulate first ourselves. We help regulate the youth. We cannot get to a point of reasoning with a child when they are at the height, that peak point of that escalation cycle, trying to reason why their behaviors aren't working for the moment, why they shouldn't be doing something, what they should be doing differently. When they are dysregulated, that is not the time to have the conversation. So we first have to get a child regulated, make them feel more calm and relaxed, and in a better emotional state, and then also relating to them. So again, that I understand, why you're feeling angry or upset or scared or confused. It makes sense in this situation, being able to relate to them. And then being able to get to that point of reason of how can we solve this problem? What worked and didn't work in this situation? Sorry, y'all, I'm trying to get over a cold here. What worked and didn't work in the situation? What can we do different next time? Are there some coping strategies that maybe worked this time that we can use again? Or were there things that we didn't try that we had talked about trying in the past? How can we prevent that from being a barrier down the road? So getting to that point of being able to reason with the individual. And another technique is what we call mirror and match. And so while I spoke earlier about, presenting with a calm demeanor and making sure that our voice volume isn't too loud, there is also something to be said for mirroring and matching and helping de-escalate with the youth. So I'll play this short video clip that better explains what that looks like.
Hi, my name is Bob Nichols, and I'd like to talk to you about something I call mirror and match. It's a way of using your body to show validation for someone else, to show that you're taking them seriously, and also use something called mirror neurons, which is how our nervous system starts to echo the nervous system of other humans around us, to help both of you feel calmer. So when someone's upset, they may be upset at like a 9 or 10 out of 10, and they may be making choices that make themselves and other people unsafe. If this is happening, you may need to get big in your body to match them, or even in your volume to match them, so that you have a big posture, open hands, so if you need to block something you can, but also so that they know that you're taking them seriously. Someone is getting really big with you, you don't want to say, it's important for us to stay calm, because they will feel invalidated by that. I'm having a big feeling and you're telling me to stay calm. That makes me more upset. I was at a 9 and now I'm at a 10. By getting big, we're showing them it's really important to us. But when we get big with them so that we're kind of mirroring what they're doing, we're saying something that's very validating, or that's just telling them something that's very soothing. Something along the lines of like, I'm getting big in my body. I'm saying, like, I could tell you're really upset. I really want to understand that. So my words are actually very connecty, but my body is big so that they know, and then I'm just going to make my body a little bit smaller or softer. I might turn my volume down a little bit. If I can get them to engage with me at a big level, we might connect at a little bit smaller level. I might start to relax my body intentionally to see if their mirror neurons will catch it and if they'll do the same thing. So I can get them to relax a tiny bit. I'm going to keep saying things like, I can tell you're really upset. I really want to understand. I might start saying back things that they're saying to me. And if they can match me, if my posture softens and their posture softens, then I might make my posture even a little bit smaller to see if they'll get smaller. I might even invite them to sit down, or sit down myself. And if they do sit down, then I can continue to get smaller until suddenly we're two people who are very upset about something and talking about it together. Sometimes we might alternate with some close-ended questions in there. They're just yes or no, nothing really thinking about. But then I may throw an open question just to see, like, can you answer this question that's a little bit self-directed? If they can, that means they're in the front of their brain, they're starting to be calm, and we're a step closer to solving the problem that got them upset in the first place.
Okay, so that's the mirror and match technique. So in that case, being able to meet a child where they're at and then slowly de-escalate with them can be very validating and provide that attunement with the child. Some other strategies or things to keep in mind while engaging in de-escalation include giving space. A lot of autistic youth don't like being touched. Sometimes that can be confused, even if an individual may be comfortable initiating hugs or touching others, or like, well, they're always like in my personal space. Why would it be bothersome to touch them? It's that piece of control for them, where if they are in control of the touch, they know that it's coming, they know to expect it because they are doing it. Whereas when others touch them, it can feel very uncomfortable, unexpected. They're not in control of that touch. They didn't initiate it. So that's something to keep in mind. Putting a hand on their shoulder or trying to give a hug may not be something that is comforting to them, even if it may be something that in your experience has felt very comforting. And then we also want to provide at least 3 feet of space. This isn't a hard and fast rule by any means. It's more so just to be mindful of not matching a confrontational response or stance with youth that may be kind of doing that towards us. If they're posturing towards us or getting closer, we don't need to match that. We want to give space when they're escalated. Also, because being too close to others, to anyone, can make them feel trapped and even further escalate the situation. Along these same lines, if there are a lot of people around, limiting the number of people present. So an example of this I see a lot on our psychiatric inpatient unit. When a child is becoming overstimulated, wanting or becoming escalated, a lot of people want to rush in and help and support, but that in and of itself can kind of make you feel trapped, and there's a lot of people, it's just you. If everyone's kind of talking at you at once, there's that sensory component, there's a lot happening, and yeah, you can feel trapped, almost like a caged animal. There's so many people around and not seeing a safe way out of the situation, especially if those other people that are around may be, security guards or even officers or other people of authority. That can be really, really scary. So always being mindful of, everyone stepping back. We don't need excessive people present. We're going to, if you do need someone else present for safety, that's fine, but making sure that we're not too close, no one's running towards the youth, and just being really mindful of that space. And then, of course, we've talked all about, overstimulation and all of the sensory sensitivities and things that autistic youth often experience. So when a child is escalated, they may prefer dim lights. If you're at home, turn off the TV, turn off the extra noise that may be happening in the background. Limit those, again, that number of people present. They may have like a calming place that is most comfortable for them, whether it be in a classroom, be in their home. As I'm talking about our inpatient unit, there's a sensory room that has dim lights that you can change the colors, change the sounds to like, beach waves or just white noise. So being able to provide a more calming sensory input or reduce sensory input. So sometimes there are those sensory seeking behaviors, liking soft blankets, wanting a weighted blanket, things like that can be helpful. And then sometimes silence is most important. I spend a lot of time talking about what to say to youth when they're overstimulated to be validating. But sometimes, and depending on the individual, just being silent can be a powerful de-escalation tool. Not talking at all, just sitting with them and being near them, that can feel also very validating that you're giving them the space to have the feelings without trying to fix anything, without trying to comment on anything, just being present. Now, when it is time to say something, either because they have calmed or as the escalation is increasing, being able to provide some instructions to keep everyone safe. Some of the things that can be said include giving options. So giving 2 clear, short options can give some control back to the autistic youth, because a lot of times what led to the escalation is feeling out of control for a number of reasons, not feeling safe in their environment, feeling overwhelmed, something unexpected happened that was out of their control. Something didn't happen the way that they wanted it to happen. It just didn't work. So if we can give options that are reasonable and appropriate, if they choose either or, that can give them control and still lead to whatever it is that you're all needing to be doing in this next step past the escalation. Provide instructions. Instructions should be simple and clear. We want to avoid repeating the instructions. If they are not responding to the instructions, it is likely that they are too escalated to be able to respond to those instructions appropriately. And that's when we switch to some different strategies. We don't want to over verbalize, especially for youth that have potentially some receptive language challenges. We want to just be simple and clear. And even if not, I think for all of us, when we're emotionally dysregulated, being clear and concise is helpful instead of over explaining everything in the moment. So if the instruction is, we're needing to have a calm body so that we can then go to whatever the new transition is, for example. And then also any attempts at self-regulation should be praised. If you're seeing that the child is trying, maybe trying to count, maybe taking some deep breaths, maybe stepping away, walking away, turning around, because, rather than confronting and coming closer, praise those attempts. Now, also, I'll give that caveat that, if you know this child, if, for example, if it's your own child or a student that you've worked with for a very long time, sometimes praising can feel, belittling in the moment, or just, not, some youth are less inclined to take praise positively. So that's something to keep in mind, but others do, and being able to label that praise so they know what it is that they're doing correctly. So if this child is not one that will respond in the moment, that's something, in that debriefing phase after a child is calm, that you can say, I noticed that when you got upset, you walked away and walked out of the room and then came back and you were so much calmer. That was so wonderful. I love seeing that, so being able to talk through the things that they were able to do appropriately in the situation. Now, unfortunately, there are those occasions where using de-escalation strategies are not working for whatever reason. Either they are just way too escalated, or the situation is very unsafe for them or for those around them. And so I do want to touch on some of these last resort measures if de-escalation isn't working and you've tried all the strategies and things have become very dangerous. So I do want to highlight that these are interventions of last resort and should only be used by individuals that are trained and appropriate and engaging in these interventions. So there are times when youth may require a restraint, which is any kind of physical force that either reduces or completely immobilizes an individual so that they can no longer be of harm to themselves or to others. There is specific training that has to go into being able to use restraints, whether in a school setting, inpatient setting, home setting, making sure that you're informed on restraints that are not going to cause harm to a child, not attempting restraints that require, you know, 2 people if only 1 person is present. So being very, very mindful of that. And seclusion is any kind of involuntary confinement to an area when they are by themselves and they are physically prevented from leaving. They cannot leave, whether it's because the door is locked or something is blocking the way. This should be something that is happening on the very rarest of occasion, and typically more like in a psychiatric inpatient setting where they have appropriate training in seclusion and everything is documented and videotaped and all of those pieces. So, but do want to just highlight, you know, some of those what if questions that come up of when de-escalation doesn't work or a child is becoming a safety risk more consistently to a higher degree around others. That sometimes these are interventions that take place. Another component that I had very briefly touched on a moment ago was that debriefing piece. And that is very, very important to managing escalated youth. It's just as important as attempting the de-escalation in the first place. There should always be a period of debriefing once the child is calm. Once you're calm, once everyone is calm. Debriefing when anyone is still escalated is not going to be a productive, useful conversation and will likely lead to more escalation. The reason why this is so important is this is one, an opportunity to talk about the things that went well. So any attempts or successes with that child being able to de-escalate or use a coping strategy to calm down, you know, we want to emphasize it then. It's also a great opportunity to prepare for any possible future events. You know, what were the triggers going on? And having that conversation, if they're able to identify, you know, well, I didn't get what I wanted, or I wasn't ready to transition, or, you know, there wasn't enough warning, or maybe things that you observed. Maybe they're not even quite sure what went wrong and what happened to lead to that escalation. But if you're able to identify what may have been some of those triggers, and you can also bring those up of, you know, I noticed that you know, when we had to transition last minute, and normally we were able to give you like a 5-minute warning, that was really upsetting to you. Is that accurate? Did that, you know, make you feel upset? And then also talking about those self-regulation strategies. What worked? What didn't? What didn't we try that we had talked about trying? How can we prevent any barriers from using self-regulation strategies in the future? What are maybe some new self-regulation strategies that can be practiced to help lead to successful prevention, if not at least successful de-escalation in the future? I also want to highlight some typical reasons why a child who's escalated may become more escalated. So these are kind of like the do-nots of interacting with youth when they are escalated. We don't want to reason with them. When someone is upset, the last thing you want is to have someone reason with you. It can feel very invalidating. You're not in a mental state to be able to, you know, think through the problem. So reasoning at that point is not going to be helpful when they're escalated. Making demands that they're not able to follow through with in that moment. So similar to what we talked about before, especially like repeating demands, we don't want to do that. If they're upset, trying to get them to do a bunch of other things, you know, like clean up your toys. You have to clean up your toys. We're not going to go have fun until your toys are cleaned up. If they're escalated, they're not cleaning up their toys right then. We have to pause from that demand, de-escalate, and then come up with a plan. Unnecessary constraint, of course, is not helpful. You know, getting too close, touching, holding back, anything like that is only going to make someone more uncomfortable and upset. And also, we want to think about coming from a trauma-informed approach. We do not want to be, constraining anyone in unless it is absolutely necessary and other attempts have been made and failed. We do not want to yell over a child who is escalated. So, we talked about this with that mirroring and matching. We may start louder, but not from an angry yelling or assertive yell, and then, calm our voice, or present with a calm stance and voice from the get-go. But we do not want to yell over a child to be heard. If they are yelling, that's where we pause and take a step back. We also don't want to talk about children in front of them. This seems like an obvious one, but it happens way more than we probably realize as the adults in their lives. We don't want to talk about them. We don't want to assume that they're not understanding what we're talking about. This is so important for all children on all different cognitive and language levels. We always want to assume that if we're talking in front of them, that they understand, even those with limited, expressive language skills. If you haven't already been amazed and witnessed for yourself, I'm sure that you would be to learn how much they see and hear and understand, even if they're not able to express it back. And so we always want to have the utmost respect for the youth that we are around, that we live with, work with, care for, and making sure that we're never talking negatively around them, in front of them, or about them. So now I want to get into some preventative measures. Obviously, escalation is hard to, 100% prevent, but there are some preventative measures that we can take. One, and I'll get into some examples of a few of these to give a little bit more than a brief overview on. But one thing to do is provide structure. Autistic youth especially, don't like those, and I'm kind of generalizing, but, quite a few autistic youth do not like changes in routine, like to follow a structure and schedule that helps them then to prepare for transitions, and knowing what's going to happen on a daily basis, throughout the school day, or in the evening or on the weekends. We tend to see more escalation on weekends because that's less structured time. It's supposed to be fun time, but sometimes when it's unstructured, it doesn't feel fun when you like to know what to expect and what's coming next. Also, when you're able to prepare for transitions and changes that are coming, if things are going to be out of the norm, if at school a special speaker's coming in, or at home, you're having company come over, or it's supposed to be a special fun weekend activity, making sure that you're preparing and talking through those things. You can even use social stories if you have enough warning that this change is going to happen. Visual support's very helpful, especially for those with more language challenges or delays. Being able to have that visual component to either know the steps to complete an activity, or in terms of having a schedule. A sensory diary can be very useful. So some of those things that we touched on before in terms of, calming noises, calming lights, soft blankets, weighted vests or blankets, comfortable, cozy, favorite stuffed animals, things like that. And then remove all the uncomfortable stuff, the loud noise, the too many people, anything that is just too distracting and overstimulating. We also want to teach communication skills. If a child is able to communicate what they want and need, that can be a really great replacement behavior for the escalation in the first place. And this is, not only for those that may have language delays or language disorders, where, we may use visual communication or signs or things like that, but just in general, better ways to communicate when we're escalated, and all of our communication strategies tend to be less effective. Teach those self-regulation strategies, ways to calm down, deep breathing, progressive muscle relaxation, mindfulness, counting to 10, walking away, things like that. Recognize our own behavioral, help them recognize their own behavioral responses. So if they are able to identify their triggers, and when they're starting to get agitated and escalate, if they're able to recognize that, then they can learn those self-regulation strategies that they've been practicing, implement that, and hopefully not get to that peak point of that escalation curve. Exercise, very helpful. We know that it changes the chemistry in our brain. Those endorphins are very important. Exercise can be huge in helping in calming and relaxing and making us all happier individuals. And then giving reminders too, giving cues, giving prompts, giving those visual reminders to use strategies or use, some of these preventive skills of, remember you have, your blankets if you need them. Remind them what tools they have at their fingertips. And then these are some examples of those visual supports and schedules. There are some nice websites that have free visuals that can be downloaded that are either already put into schedules or that you can use to create your own. Do to Learn is a really nice resource that has a lot of these. So these are just examples of visuals of, for example, what happens when you go to the doctor and are getting a blood draw. Being able to talk through what that's going to look like. You check in at the front desk, you sit in this waiting room, and then you're going to go to an exam room that looks like this. And then, these are the different steps that the doctor is going to take or the nurse is going to take to make sure that they know what to expect. And it doesn't become one of those unexpected new situations that feel very overwhelming. Also, just having that visual schedule for the day can be really helpful for the school day, for at home, for any new situations. If they're able to check off, what they've done to see what's coming next, that can be really reassuring when things are going the way they should go, and also to be able to prepare them for a change or a difference in their schedule. These are some examples of what can be used for sensory input. Every child's different and prefers different things. Some prefer those textures, that sensory seeking, like slime and fluffy slime and those water beads. Some children absolutely hate those, and that would be very may cause some escalation. So wanting to be mindful and finding the things that work for your child. What is it that is calming, that could be used even as a distraction if, a triggering event is happening and you're seeing it happen? Being able to pull some of these tools out for them can be very helpful, or it can be used, as that calming piece as they're de-escalating. Some of those self-regulation tools that can be really helpful in teaching children how to regulate themselves, how to identify their triggers, how to effectively calm themselves down, include some of these different types of visuals that can be worked on, again, not when a child is escalated, but as a prevention. So one is using like a simple 5-point scale for a child to identify where they're at right now. Are you feeling calm and relaxed? Are you getting really angry? Are you already at a 5? Or you can talk about past situations of, yesterday when you were really upset. Where were you on this 5-point scale? and how did we get from that 5 back down to a 1? So you can use something that's a little more concrete and visual to teach those different stages of escalation. And then also creating a self-management plan. What should you do when you are at a high, when you're starting to engage in those aggressive behaviors, and what do you need to do in that situation? When you're calm or when you're low, there's some of those agitation, come up with a plan with the child to, determine the strategies that are going to be helpful. There's also a point too when we have to determine if more supports are needed. So if a child is recurrently aggressive and engaging in self-injury to a degree that is very, very unsafe, if there is a level of elopement that cannot be contained and it is very unsafe, they're eloping from the home, eloping from the school, going into, traffic, wandering off. If there is a threat of suicide, if they are making suicidal statements and threats, or have a plan, or are showing intent, or if the family can no longer care for them safely in the home, if they have exacerbated all their resources and cannot keep them safe, it may be time to take a next step. And at that point is when providing resources for the family to go to the emergency department if there's an immediate risk to safety to themselves, or they are not safe around others. This may lead to a psychiatric evaluation while they're in the emergency department, or possibly inpatient psychiatric hospitalization. So again, these are kind of what we want to prevent from happening, but also just wanting to cover all of the possible things that can occur, especially when those de-escalation strategies just don't work or are no longer working. And that is it for me. So I'll stop sharing here so I can see you all again. There we go. Any questions?
Thank you so much. We did have a question in the chat. I think we are addressing that. We'll also make sure that everyone has your email information to get in touch if they have further questions. But just thank you for your time today, Dr. Girard. That's very valuable information. We appreciate that. We also want to thank all of our attendees here today for joining us. You'll receive a follow-up email with a link to the recording of this presentation, as well as a survey where you can let us know, giving us your feedback, and let us know other topics you're interested in. We invite you to join us for next month's webinar, Thursday, May 16th, 11:30 to 12:30, for Healing Spaces, Reducing Trauma, One Garden at a Time, hosted by My Nary's Dream Alliance with Dunsella Wilson and Vanessa Holloway Truxton. We want to give a huge shout out and thank you to our superhero level 2024 Children's Mental Health Matters campaign sponsor, Backpack Healthcare. They aim to provide personalized, accessible, and inclusive mental health care to the most vulnerable and underserved children nationwide. And if you haven't already, we ask you to join the campaign as a champion for 2024. We are at 500 plus, and we'd love to have you join that growing group. Learn more about what it means to be a champion and to advocate for the mental well-being of children in your communities. We look forward to working together to support the well-being of families and communities across Maryland. If you have any questions, reach out to the campaign team at info@cmhm.mhamd.org. Thanks again.
Thank you.
Thank you, Dr. Girard.